Good afternoon. My name is Lauren Gustus. I'm the editor at the Sacramento Bee. Thank you for joining us today. This is a virtual get-together, and it is the first of its kind for us. We wanted to say thanks to those of you who are supporting local news and information gathering efforts. And so we're going to have an informal conversation today about how we do what we do. Many, if not all of you, have subscribed or donated to support the Sacramento Bee's coronavirus coverage. You've donated at givebutter.com/SacB. You've subscribed, you've read our stories, you've thanked us for our coverage, you've rightfully been critical of our coverage, you've made story suggestions. We recognize the trust that you place in us to deliver breaking news, to hold people in positions of power to account, and to help you find opportunities to help others. It is an awesome responsibility, and it is a great privilege. So this afternoon, we will share with you how we are covering one of the biggest stories of our lifetimes. I, for example, am coming to you today from my 4-year-old's bedroom, which is now my home office. Many others are out in front of this, the virus, and they are the subjects of our stories. They deserve our support and our help, and we're grateful to all of them. We recognize that we're fortunate to be able to do what we can do in part from our homes. So with that, I'd like to introduce our guests who are joining from their slightly more distinguished home bureaus of the Sacramento Bee. First is Cathie Anderson. Cathie is our experienced healthcare reporter. Her early reporting on the coronavirus in California deepened our understanding of this pandemic at a critical juncture for the state. She'll be joined by reporter Sam Stanton, who we'll hear from in just a minute. Sam has been on the front lines of our coverage from local churches to the Capitol protests. I'm going to welcome Assistant Managing Editor Ryan Lillis to steer this conversation with Cathie and Sam. We'll be sure to leave time for questions from our reporters, You can leave them in the chat. And we will get to them if they make sense as we move through the conversation or towards the end of the conversation. So again, leave questions in your chat boxes, be it on YouTube or Facebook or sacb.com. Assistant Managing Editor Ryan Lillis is going to lead the conversation. Thank you, Ryan. And thanks to all of you who are tuning in today. Have a good afternoon.
Thanks, Lauren. And thank you so much to everybody for joining us. Again, as Lauren said, just an informal conversation to kind of peel back the layers a little bit for the readers on how we do what we do. I'm coming to you from my bedroom, where I fully expect a guest appearance from my 16-year-old cat at some point during this forum. But just to kind of walk people through the process as we've been covering this story now for 3 months. And we're going to start that conversation with Cathie Anderson, who is our lead health reporter. Cathie has been at the Bee for 15 or 16 years, I believe.
17, Ryan.
Health for us here for quite some time. And as soon as Cathie is able to load up here, we'll talk through what this has been like from her perspective, from the day that this virus reached Sacramento in mid-February, through dealing with this crisis at all of the regional hospitals, kind of the challenges in getting information out of hospitals, and then trying to place a human element on this. And we will, as soon as Cathie's up there, we'll have that conversation with her. Cathie, can you hear me?
I can. Can you not hear me?
Maybe I'm having technical difficulties.
I'm here.
Oh, well, Cathie is apparently speaking to me, so I am having technical difficulties. I apologize for all of that. I'm going to jump out. Cathie, maybe if you want to lead a bit of a conversation about what it was like when that first case came to us in mid-February, and just walk us through that process. Oh, there you are, Cathie. Now I can see you. Can you hear me? Yeah, sorry about that. So yeah, as we said, we're working this out as we go along. So good to see you, Cathie.
Thanks.
Yes. So
I've actually been at the Bee for 17 years, and let me tell you, this is all new for me. So I'm going to be figuring out where my face is and whether people can hear me for the whole broadcast. So.
Well, I'll tell you what, I'm going to let you talk since apparently I am the broken element here of this chat. But so just take us back that February 19th, were you able to pick up right away how serious this was all going to be?
Yeah, I don't think that anyone could have known that we would end up in the place that we are now. But I knew that it was quite serious from having followed it when it was still in China and when they first did the ban on travel here for Chinese nationals. And I was concerned then, and I think a lot of Americans were concerned then, because still we had Americans returning. So the one thing that I wanted to mention when we start is that this is still an emerging disease, emerging illness. And so there's still a lot that we don't understand fully about it. And there's still a lot of research coming out. We're just now really getting to the point where we understand how it affects children a little bit more. So, and it can be quite serious in children. So I want to go back to February 19th because that was when Sacramento kind of got into this story in a national and international way. That's when we had the first case of person-to-person transmission in the community. We had a person-to-person, a couple of them before then, but they were from travelers who infected spouses. So it wasn't really out in the community. And this first case of community spread here in Sacramento was the first time that we knew of it. And UC Davis doctors were the ones who sort of pushed the CDC to actually test the patient, right? Up until then, the CDC's policy was not to test anyone who hadn't traveled yet. And this person had no history of travel. So it just took them a little time to work through that protocol. And they finally got the patient tested. I think I was surprised by it, and also surprised how the news came to me, because I got the information from a friend of a friend, someone who I knew who knew people who were high level at UC Davis. And she shared a memo with me. And I was able to confirm that and then write the story on it. And it was late at night, really, when we sort of got that confirmation. So it was interesting, because I know that people think that the media will print anything, but the truth of the matter is it took my editors a while to decide, will we print this? Are we going to go with this story? I mean, we spent a couple hours really debating that. And so, so the process here is not as loose as some people think it is.
And I mean, you think of February 19th is when we have that first case, and it's not until really March 13th, March 14th, you start to get schools closed, you start to get offices closed, events canceled. That Kings game, I believe, was March 11th that they canceled right before tip-off. So you're talking 3 or almost 4 weeks between that first community spread case for the Solano County woman to when, it's almost like a all hands on deck, all these things happening. I mean, what was that like in that interim period? I mean, did you get the sense right away that we were going to hit that kind of crisis mode, or were you surprised it took as long as it did to get into that crisis mode?
I think I watched this about as breathlessly as everybody else in the nation. I mean, I certainly didn't have time to bail out of my 401k there, Ryan. Certainly it hit my portfolio like it did everybody else's. So I guess that for me, even though I had seen what was happening worldwide, you always think that the US medical system and the US government, and all of these things are going to step in, and that we're not going to have the same degree of catastrophe, right? But it hit us just as hard as it hit any other country, perhaps even worse, as we're seeing now. I think that the story that really exemplified this for me was the story of a couple here in the Sacramento region who had come back from a trip to Egypt. And the husband came back feeling like he had a little cold, and ended up about 4 days later in the ICU at Mercy General San Juan, and then 23 days in an ICU. And we wrote about his ordeal. Over the course of the time that he was in, he'd come back a little sick.
Yeah.
Before he went into the hospital, everything had not started closing down. And I think within the 23-day span, he came out of that, and there was no sports, there was no anything, and he was completely baffled, by it all. And I think that even though we all weren't in a medically induced coma, it still probably felt a little bit like whiplash for all of us. And it was fascinating telling his story. And I'm always so amazed that people allow us into their lives in that way, because they shared so much more than I was able to put into the article, intimate details of what happened to them. And his wife ended up getting the disease too, not as bad, but I think that whole notion of having a loved one in an ICU and not being able to be near them because the COVID patients are secluded. And so family can't go there, and she's a nurse. She wanted to be there with him to take care of him. That is probably one of the most torturous aspects of this whole epidemic or pandemic. So.
Yeah, I mean, one thing that has struck me about covering this story, not just for us, but it seems like in a lot of other media markets also, is kind of the lack of a personal side to this. You don't see a lot of stories about people who die of the virus. You see a few stories of people who have it and then beat it, like the vigils that you're talking about. So and I don't know why that is. I don't know why there maybe isn't that kind of more of that personal feel to this story. Sometimes for me it feels a little apersonal. Can you talk about that challenge a little bit, and kind of getting beyond the numbers, right, and beyond the science, and how do you tell this story personally so that it really resonates with people?
I think that one of the most difficult parts of this whole thing is that there's some kind of people feel like they have the plague, so they don't want to talk about it because they're concerned that, well, what will my coworkers think, or what will my friends think, if I talk about this and I actually had it, will they think they're still going to get it from me? So that has been difficult because people tend to be a little bit more private about it. But I think that people are opening up. Certainly we've seen some stories on people talking about having it and surviving it. We've also seen a few on deaths. I think that it's really important in those stories to listen to the subjects, like I did with the vigils. I spent a lot of time with them, a lot of fact checking on details with them. What I found to be really effective was, in this day and age, texting. I texted a lot of questions to them and got quick answers on details of what they went through. But I think that one of the greatest challenges is that we all think of, at least I do as a healthcare reporter, I think of the doctors being separate, right, from the hospitals. But in fact, hospitals have, really cracked down on physicians and nurses and other staff. I mean, it's like if they talk or say something, physicians have not been given shifts, not been given hours. Some things people are really concerned about talking to the media these days. So it can be very difficult to get the story from the physician and healthcare worker point of view. And in those cases, we've had to grant anonymity because people are really, really concerned about retaliation from supervisors. So it's been really great to tell those stories, but even spouses have felt that, for instance, a spouse will say something on social media, or they'll talk to the media, and their spouse will be told at work, we saw this, or, can they
Yeah.
take this down? So,
Yeah.
That's a really difficult aspect of the story, just getting doctors and nurses to talk to you.
Yeah. Again, I'm Ryan Lillis, Assistant Managing Editor at the Bee. I'm joined by Cathie Anderson, our lead healthcare reporter. You're talking about HIPAA, which for a lot of people know what HIPAA is. It really shields medical organizations from, frankly, granting any information sometimes. And public agencies, public health agencies, and hospitals have been extremely reluctant to share even basic data sometimes, or give any kind of personal or biographical data, frankly, on who is contracting the virus, who is dying of it. What is your perspective on that? Because I think there is that argument for if you are that personal side that you're talking about, putting a face on this, not just for the people who get the virus, but the people who are so bravely fighting the virus with the doctors and nurses. Putting that human face on it makes it, you can argue, makes this more real for people to maybe perhaps take it more seriously. I mean, you just talk about the challenges as a healthcare reporter, dealing with HIPAA, dealing with all of these roadblocks you face probably on an hourly basis?
Yeah. The great part, I'm glad you asked this question, because the great part about covering this at the Bee is that I have some exceptional staff, colleagues, rather. I call them hive mates here at the Bee. And they often cover angles of the story that I would never think to cover, or that I don't have time to cover. So, but one that I didn't think to do was done by my colleague, Ryan Lillis. He did an article on HIPAA and what really it doesn't cover. And it's interesting. It's supposed to protect patient privacy. So they shouldn't be revealing anything about our records, and they shouldn't be revealing anything about a patient that makes them identifiable. But often it's used more broadly than that, just to quash information. And so that is an issue. It's difficult to get through that. But at the same time, once you build up a rapport with doctors, nurses, as I have over the years covering healthcare, sometimes they will bring a story to you and they have a patient who is willing to tell their story and wants to tell their story because they want people to understand what it's really like. And so I've benefited from that. I did want to say I do have an amazing group of colleagues covering this with me, and hopefully you'll hear from more of them. And I want to thank you and all of the donors to the Give Butter campaign. I have been really so touched and amazed that people have done this. $125,000, more than that.
Yeah.
We're hoping to raise $200,000. So thanks for that. And any other questions?
No, Cathie, thank you so much. And, thank you for your dedication. I'm not sure you've taken a day off yet since this started. I really appreciate, the readers appreciate it. And you can tell, and I just want to echo, with the Give Butter campaign, just, I hope people appreciate what you're doing every single day to tell this, frankly, the biggest story of our lives. And just kind of trying to cut through what can be a very scientific, right? A really kind of technical, probably very confusing time and subject, and report it in a way that people can understand it and make decisions on their own. So thank you so much, Cathie. Thank you for joining
Can I
us.
say one more thing? I'm really glad to have the experts at UC Davis. They've done a tremendous job worldwide of tracking zoonotic diseases like this one. And it's been great to have them as sources on all the articles. I really appreciate their expertise. One of the best the best veterinary school in the world. And I'm looking forward to hearing from Sam Stanton. So I'm going to stick around and listen to you talk to him.
Sounds good. Sounds good.
Okay.
Thank you so much, Cathie. All right. Take care.
Bye.
And so we're going to move on to Sam Stanton, a reporter at the Bee, who has been covering the protests and for the last couple of weeks, but also covering the story from other angles. Sam, good to see you. Nice beard.
I'm not shaving until I'm back in the newsroom, Ryan.
Well, okay. In that case, I may have to keep you out of the newsroom for a few months. So Sam, Sam has been all over the world for the Bee, has covered some pretty intense breaking news events for us, from Somalia to fires to OJ system to you name it. How do those compare to being in a scrum of 1,000 people trying to storm the west steps of the state capitol?
Well, I've been in a lot of those scrums before in some protests that got violent in the past, but I've never been in one where I thought if I breathe too hard or I lean against this person, I'm going to get sick and die. That first event out at the Capitol on April 20th, where, I found myself just enveloped in people, none of whom were wearing masks, and I wasn't wearing a mask at the time because I wasn't expecting it. And I find I'm able to get people to submit to interviews more readily if I'm not, standing there with a mask on. And I tried to social distance, but the way these things have played out, particularly the one on May 1st, where the CHP stood toe to toe with their riot batons up against the crowd. Well, Paul Kitagaki, our photographer, and I were right in the middle of that, right up against the CHP, and nobody was wearing masks. And by that point, I had two on, and I was doing a live stream for the readers and the viewers. But boy, in the back of your mind, you're thinking, I hope nobody here is sick.
Yeah, no, I mean you don't know. It's not just who have they been exposed to and who have they been exposed to. We talk about this contact tracing thing that's now become such a focus in terms of if someone gets the virus, everyone who they've been in contact with. And I mean, it wasn't like you could have done the old social distancing in that, right? There was no way to back out of it and tell the story.
No, there's no way you could cover the story without being in the middle of it. Saturday's protest was a little different, and I stumbled on that. I was off the bike ride and saw what was happening, and I was in that crowd for a while, and then later moved into the cordoned off area where the CHP were, just because I could get a better camera shot for the videos from there. But most of these protests, you are there toe to toe with these people to get interviews, to get them to tell you why they're there. And there's just no way around it. It comes with a job. And I got to tell you, the notes I've gotten from readers, both on the videos and in my email, thanking me for what we're doing, I can't tell you how much we appreciate that. Seriously, it really means a lot to us as we go out into this weird world and try to get the stories to bring back to you, to tell you what you need to know about what's going on out there.
You mentioned you just happened upon that one on Saturday on a bike ride, the protest.
Well, I thought I should probably ride by the Capitol just to be sure, and
because you live right around the corner.
No, but I just thought, well, who knows? And as soon as I got there, of course, I saw 25 guys in camouflage and hats carrying flags, and I thought, well, that might be a news story, based on my limited experience. So.
You mentioned, though, the importance of being in there. I mean, not all of the media is in that scrum. In fact, I have some images in my head of that first protest on the 20th, and this is not a criticism at all, but a lot of the media was behind the CHP line, was up on the steps. Why not just go back there and observe?
You can't get the story that way. You have to hear what people are saying. You have to talk to them, the ones who will talk to you. A lot of them will scream fake news, that type of thing. But if you want them to talk to you, you have to be next to them, having a conversation. And the only way that I can tell the readers of the Sacramento Bee what these people want is to ask them and to talk to them. And the messages are different. There are a lot of different elements in these crowds. They've all basically turned into Trump rallies toward the end, but there are also people concerned about vaccines. And my daughter's former salon owner was out there Saturday apparently because her salon shut down. These are people who've lost their jobs, lost their income, can't go to church, can't go to school, and they're concerned about it.
That's a really good point, because it does feel like sometimes coverage of these protests the people in the protests are portrayed as some kind of, carnival act, or the other California, or, frankly, just crazy. But there's a perspective there. And so talk about how important it is for you to give perspective also, right? So that it's not just unfiltered screaming into the ethos, for you to preserve the perspective, but also the importance of capturing, as many perspectives as possible.
Well, that's why you have to talk to these people individually. The people who just they want to go to church. I mean, there's a large element of that out there at these things. They want to go to church, and they've read the Constitution. They have the right to worship any way they want, and that's what they want. And of course, the courts are holding otherwise in terms of Governor Newsom's stay-at-home order and his emergency powers. At least so far they are. But there are people who aren't there because they're crazy or they're fringe. I mean, there is some of that. There are people who don't have jobs, who want their livelihoods back. And there are weird elements to it out there. I was in one of the protests. I looked down and the guy I was crushed up against had a buck knife on his belt. And we've had problems with knives at the Capitol before, as you well know. But there hasn't really been any violence. There has been an incredible amount of screaming, and there are things that I never thought I'd see in California. Twice out there, they had a gigantic banner that had the governor portrayed as Adolf Hitler with a giant swastika behind him. And on Saturday, there were a couple of people giving Nazi salutes to the CHP and likening them to the Gestapo and the SS. And, the CHP's out there doing their job, trying to keep everything safe. And they don't respond, obviously, because, they've been trained not to. But it's disconcerting to see in the capital of California.
Do you think, back to that first protest, do you think the protesters were surprised that CHP, didn't just say, "Oh yeah, come on in," that they actually got pushback from authority, because perhaps these are some of these folks aren't used to being, questioned by law enforcement, frankly, or being arrested. But was there any element of, whoa, wait a minute, you're gonna detain me? Was there a surprise to that?
Well, there was surprise with the April 20th one. They were surprised by the fact that the CHP gave them a permit to be there, despite the governor's order, and nothing, happened that day. Nobody was arrested. And when in the May 1st protest, where the CHP finally shut it down, they were surprised at first because they had been there for hours without any difficulty, and they did not have a permit for that rally. And the CHP was out there, but they weren't wearing helmets early on. They were walking through the crowd. They were waving to people, and they'd occasionally go over and say, "Remember, keep your social distance." And they clearly didn't plan to take action. And then it started to get so crowded. There were 500 cars circling the Capitol, honking their horns, and there were at least another 400 people on the grounds. And as they got closer and closer together in a large crowd, that's when the CHP said, "That's it. We're shutting this thing down." And they ordered them to disperse and make their way out to the city sidewalk, which is the province of the Sacramento Police Department, instead of the CHP. And the confrontation was extremely tense and went on for the better part of an hour. Just a lot of screaming, and some of these folks have bullhorns. My ears are still ringing from one of them. I mean, they just scream anything they can scream at the CHP and at the building because they're trying to get their message to the governor himself. So yeah, I think they were surprised, but I think there are indications that some of these people wanted to be arrested. In fact, at the National Day of Prayer rally last Thursday, at the end of it, they called for all of the people who'd been arrested, there were 32 of them, to come and do a group photo in front of the Capitol as a souvenir. So
Yeah, well, okay. And of course, that second one there on the National Day of Prayer with the pastor down from Riverside County was far more peaceful, far more controlled. Seemed like they were actually trying to send a message. You heard it during some of the live streams of, don't fall into the trap of us being the bad guys here. You feel like they maybe regretted how sideways things went that first time, and then we're really trying to send a message with the subsequent demonstrations of, we better stay peaceful here, or we're going to lose any kind of public support we may have.
Well, I think a big part of it was the fact that they couldn't get on the Capitol grounds for the Day of Prayer one. They showed up thinking they were going to gather in groups on the west side of the Capitol, and by the time they got there, the CHP had cordoned off the entire grounds with these 3-foot high steel gates, and they were standing like 10, 15 feet apart all the way around. There were almost 200 CHP officers just standing there to keep anyone from getting onto the grounds. And so once they saw that show of force, and there were hundreds more CHP, all through the building, everywhere, at the ready. Once they saw that show of force, they didn't have much option. And so it was kind of like a party atmosphere out on the sidewalk, and they had a flatbed truck that they got up on and, made their speeches from, and tried to present this olive tree to the CHP as a sign of peace. But yeah, it was much calmer with them out on the sidewalk.
This is Ryan Lillis, Assistant Managing Editor at the Bee. I'm joined by Sam Stanton, who a veteran reporter from the Bee, who's been covering on the front lines these protests and demonstrations for us. Sam, just how are you staying as safe as possible in these? Tell the readers kind of how you prepare, I guess, for being right in the mix there, and what precautions you can take to maintain your safety.
There's not a lot you can do. I mean, you do the basics. You take water with you. You make sure because you're going to be out there all day long without a break. And the last protest, when I showed up Saturday on my bike in my cute little tight bike shorts, I thought, wow, this is going to be a long day dressed like this, carrying my bike around. But I had masks with me because I'm always carrying one now. And I was able to, and I always carry my press pass, which gets me into the Capitol grounds and also got me into the Bee so I could get backup batteries for my cell phone so I could do the videos that I was shooting. But what I'm doing now is, as soon as I start to walk on to the grounds near one of these things, my mask goes on. And I didn't have my N95 with me Saturday, unfortunately, but I had a mask. So, and I have gloves that I carry in my pockets, but I don't use them because I need to be able to maneuver the phones and the iPads and everything. But there's not much else you can do. You can't social distance from people and cover the event.
Did you? We had a question from a reader. Did you notice, especially on that first, at April 30th protest, the first one, that at first at least the CHP officers were not wearing masks?
Yes. Yeah, that's a good point. They were out there with the crowd. They weren't wearing helmets. And then when at the May 1st one, the same thing was going on. They were not wearing protective masks. But when they came out and ordered the crowd to disperse, about halfway through that confrontation, suddenly they all had protective masks on. And when I got down there Thursday for the National Day of Prayer one, where they had blocked off the grounds, I got there at, I think 8 a.m. And the officers were already there and they all had their protective masks on. And I got there Saturday, same thing. Everybody had their protective mask on. So clearly some kind of order has come down. They're not taking any chances.
Yeah, I mean, did we ever get a sense of why those officers at the first one weren't wearing a mask? I mean, like you said, they issued the permit. They knew that this thing was coming. They issued a permit for a demonstration of 500 people. So this thing, and they were preparing for it hours before too, right? They had mounted officers and were getting ready. So it's not like this caught them off guard. Did we ever get a sense of why that first time they didn't have the masks?
No, and I think it was just the notion that it would be less threatening, maybe less intimidating if they didn't. I don't know who made that call or why. but clearly things changed over the course of just a few days because they are completely masked up now.
Yeah, yeah.
And so are we. I mean, you know, I started the same way without a mask, and I'm not doing that anymore.
Right. Yeah, certainly not in that situation. Sam, I guess lastly, you know, where do you expect these to continue? Do you know, what was the sense you got out of the last couple in terms of the staying power of these demonstrations, how organized they are? Do you think they'll continue? I know we've seen demonstrations, you know, in Huntington Beach and other places across the country. You think this is going to be a recurring event at the Capitol?
They say it will. There are various groups that are organizing these. There were a couple different groups who had done the Saturday one. One was the Militia of California, and another was another group that was totally separate, and they just kind of merged. But until they're able to get what they want to go back to work or go to church or whatever, I think we're going to see them out there regularly. And to be honest, I rode down there again early this morning to look, and they had opened the gates partially so that the Capitol grounds technically were open. But if they needed to close them, they could do so rapidly. And you could see CHP, you know, in different parts of the Capitol grounds.
Yeah. Well, I'm glad you're getting on your bike, getting some exercise.
It's all good.
Yeah. Sam, thanks so much for joining us. Again, Sam Stanton with the Sacramento Bee has been covering these protests for us for the last couple of weeks, and will likely continue to, whether we want him to or not. So thank you so much, Sam.
Thanks, Ryan.
Yep, thanks. And so thank you everybody so much for joining us. You know, Sam and Cathie both mentioned whether it's the donations through our Give Butter campaign, our journalists, our editors, our reporters, our photographers have been watching the comments that you've all been leaving us with the donations, and it's sustained us, frankly, through this. There's no secret that media in the country right now is really struggling. Ad revenue is way down. We're getting it from all sides, and to see more than 1,000 of you donate and leave those kind words for us really has just been it's been inspiring. And the emails that we get with messages of support, we just say thank you so much. You know, give us feedback, tell us what we're missing, tell us what you want to see more of, but just stay engaged. And so thank you again so much to all of you, and thank you for joining us. Again, I'm Ryan Lillis, Assistant Managing Editor of the Sacramento Bee, signing off.